Thank you all. My name is Walt Rogers. I'm the Deputy Director of TEF Iowa, and TEF Iowa seeks to provide positive economic policy solutions to benefit all Iowans. This afternoon, we are releasing another report of the economic impact of COVID-19 on the Iowa economy, the second in a series of reports that examines the financial implications of the virus, authored by Dr. Ernie Goss and Mr. Strain. As Iowa legislators come back in session today, and all Iowans are beginning the road back to normalcy, or at least what we think is normalcy, it's extremely important that we look at the economic situation in our state. TEF Iowa is proud to have these two noted economists, Dr. Ernie Goss and Mr. Strain, join us to discuss the findings of their second report. Before I turn it over to Dr. Goss and Mr. Strain, I want to let you know that if you have a question, submit it in the Q&A section and we'll get to them as quickly as we can. So Dr. Goss and Mr. Strain, go ahead and give us kind of a summary of your report, and we can pull up whatever you need as far as graphs and stuff, and then we'll take some questions.
Okay, thanks Walt, and thanks to John as well, and Scott. And first off, I'd like to say, I think it's very important to say that some of the impacts that we're seeing are growing. In other words, the impacts are growing. And I think the second part is we look out across the landscape and try to judge how is the world, or how are investors looking at what's going on in the labor markets. And of course, most individuals know that the markets have opened up, or the economies have opened up to a larger degree because of the actions of the governors and mayors in the communities. But that said, look how the investors are looking at the economy. That's the broader economy, not just the Iowa economy. Stock investors, equity investors are saying full steam ahead. Looks like everything is a full go. We're going to have a V-shaped recovery. The bond market says no, it's going to be something else, because the bond prices have grown significantly, meaning a lot of investors see a lot of risk out there, and they're buying bonds instead of buying other investment instruments, and driving the yields down. For example, the yield on 10-year treasuries between 0.7 and 0.8%. Now I think that's need to look at that. When this began, I said there was to be a V-shaped recovery. That was in March. Then in the CEO magazine, I was quoted saying there was a U-shaped recovery. I'm now saying it's a Nike swoosh, and that means more like a check mark, down sharply. The expansion, or the return to normal, is going slowly, and I think our numbers are going to show that. Another factor we need to be aware of is that the unemployment rates that we just got for Iowa from May the 22nd, those were the latest numbers, and that was for the month of month of April. And that was for the second to the third week in Iowa, understanding that comes from a sample of 60,000 households nationwide. So the point here is that unemployment rate for Iowa has a real wide margin of error. Now that's the unemployment rate from the U.S. Bureau of Labor Statistics. Now what we based our numbers on is not from that. We're looking at the unemployment rate, or the number of unemployed that are insured unemployment. Now why is that a better number? Because it's not a sample. There's no margin of error. It's the number, and it comes from a census, or the population. So we use that number, and I think if you can bring up that first slide, we can see that how that's progressing. That would be the first-time claims for unemployment insurance. And there you see, this is individual first-time claims for unemployment benefits. And you see there in red how is the numbers for Iowa, and you see they peaked. And they peaked in March 28th for Iowa at 64,000. They've come down dramatically, 13,000, and that's May the 9th. That's the latest unrevised numbers. And that's the number we want to keep an eye on, and look at the national. So the first-time claims are coming down, but now if we can go to the next slide, which shows continuing claims for unemployment benefits, and that's figure 2. And this is the number to really watch. These are the number of individuals that remain on unemployment, drawing unemployment benefits, And as you see, that continues to be very high, continuing, I won't say to grow, but it's certainly the growth is slowing down in the nation, slowing down in Iowa. So that's the good news. Now, the overall unemployment rate, of course, is higher than this. Now, how much higher? Not much higher in Iowa, about 1.08. So you take this number of continuing claims, multiply it by 1.08, that gives us a number of those on unemployment overall. In other words, that's those who are insured getting benefits, plus those who are either uninsured or they didn't claim benefits or did not register with the service there in Iowa. And where did we get the 1.08? That's what we're seeing right now. Very slim margin. Almost all the unemployed now are getting unemployment benefits. Now that said, that's one of the reasons I think this downturn that we're seeing, or maybe downturn's not an accurate term. It's much more significant than that. We're not going to see any significant bump up, and one reason is the CARES Act by the federal government pays individuals who are on unemployment insurance an additional $600 per week. Now that expires at the end of July. So in August, assuming it's not renewed, we'll see a bump up in those getting jobs. And that's very important. Now, right now before Congress, and we're about to see another CARES Act, the CARES 2.0, if you will, and that's likely to extend some of these unemployment benefits, or some of this, maybe not the $600, but somewhere between $600 and another level of unemployment benefits. And as I said, you don't have to be an economist. When you incentivize something, you get more of it, economically speaking. And we're getting more employed workers simply because one of the reasons is certainly the extension of those unemployment benefits. So with that, we'll turn over to the next slide, which shows compares Iowa to other states in the U.S. There you see Iowa at 12.4%. That's the uninsured unemployment rate in Iowa. Now that's, the numerator is the number of continuing claims. The denominator is those who are covered. So some individuals are not covered. For example, self-employed workers are not considered either in the numerator or the denominator. So 12.4%, you see the highest in the nation is at Nevada there at 23.5%. The lowest is at South Dakota at 5.6%. And you see where Iowa is coming in there. Better in the better half of the nation than the bottom half of the nation, but still much as compared to Nebraska. Nebraska has a much lower insured unemployment rate, and for that matter, much lower unemployment rate. And now I turn to I think Scott's going to now show the impacts from those loss of jobs in Iowa. If we can get that slide up, and Scott will take it from here.
Thank you, Walt.
Well, I guess this is, sorry, this is the next slide. Sorry. It's there you see in April, the unemployment rate for Iowa was 2.7%. Now it's jumped up to 10.2. And the change from April of last year to this year, 7.5% more individuals in Iowa are unemployed. Now, again, this is the unemployment rates. This comes from the U.S. Department of Labor, and I'm sorry, the U.S. Bureau of Labor Statistics. This comes from the second week of April, second to third week. So you get some variation there. This is lower, again, lower than the number we use, which is a later number in May, May the 9th. And also our numbers come from those who are gaining or who are getting unemployment insurance. So with that, I now think Scott's going to take it from here. Sorry, I jumped in there.
That's okay, Ernie. Thank you, Walt. We estimate that in the state of Iowa, from March 21st to May 9th of this year, approximately 227,000.6 jobs were lost, with wages and self-employment income taking about over $1 billion hit. And then the total impact to the state of Iowa in terms of output sales about $2.8 billion. Go ahead, Walt.
You want the next slide?
Yes, next slide, yes, please. The fiscal impact to Iowa, we estimated using the in-plan input-output model. And how we arrived at the inputs is that we used the relationship between the unemployment rate that Ernie talked about earlier from the BLS, combine that with the high frequency continuing claims data available from the Department of Labor, use the ratio that Ernie mentioned earlier, and arrive at an overall estimate of all of the unemployed folks in Iowa. Then the process was looking at both the state, the regional, and national data to assign those unemployed people across industries. Once we were able to assign the unemployed in terms of share to different industries, we were able to input those into the in-plan model, and we came up with an estimated $190 million impact, fiscal impact, to state and local government entities in Iowa. The local share is about 70.6 million, and the state about $119.4 million. And this is for the period March to May, so it's a slice of the annual figures.
And if it, what we're saying then, Scott, if you could explain what it means if we don't gain these jobs back. Now, some of the CARES Act, the $3.1 trillion, will in fact support some of the industries, support some jobs going forward.
You know, as we see the impact from the CARE Act, we'll start to see that reflected in the labor market. But some of these jobs may not come back. Some of the small businesses may not reopen. And if you annualize these figures, you're looking at close to $18 billion in total impact for the state of Iowa.
And that's quite significant, of course.
It is quite significant. And in the fiscal impact, that $190 million grows to $1.2 billion. So it's really important for the economy to get going again, get this great commercial engine or the train that Walt talked about last time, get it back up to steam.
And we will get some of those jobs will come back. It's just how many now and what is the rate of that gain. So I would argue it'll be somewhat less than the impact. The worst case scenario. I don't know if you agree, Scott, but that might be a worst case scenario because the federal stimulus from the federal government, but also the stimulus from the Federal Reserve, which is coming in, and that some of that certainly the big state governors have argued for more and more support for state and local governments, and we'll have to wait and see how much more. Initially, there was $150 billion of support for state and local governments. And that's significant, but not enough to offset these losses that Iowa sustained, not enough for any of the states in the U.S., in fact.
No, but we are starting to see some encouraging signs. Ernie mentioned before the Federal Reserve activity in some of the credit markets creates a little bit of noise, but we are seeing improved spreads between even out to junk bonds, but also BB and AAA rated bonds. You're seeing some improvement in the credit spreads there, which should reflect in normal circumstances less concern about risk in the market. We're also, even today, the NASDAQ was very close to reascending its most recent high. We've seen passenger activity at airports increase something like 39% over the last few weeks. That's from a report from the TSA this past Saturday. Something else that you might want to think about in terms of timing, we saw initial claims in the US peak in late March, and we've seen continuing claims peak about mid-May. The peak in the initial claims should start to reflect some improvement in the labor market, the confirmation being the peak in the continuing claims. That, to me, when I look at that, at least at the national level, tells me that this is going to be a very brief downturn in the economy, despite the magnitude of the decline.
Yeah, but I think we need to warn at least legislators that bear a lot of the burden of having to predict this. In other words, we can do our analysis, but the penalty comes on the legislators that have to pass spending cuts or tax increases or a combination of both. And I think that one of the real difficulties here is separating noise from actual activity. The noise meaning the federal intervention. In other words, if we don't have repeats of this, we may not see the revival you're talking about, Scott. Now, we just don't know how much of that. The Federal Reserve, for example, has bought bonds up to $6 to $7 trillion. The bonds, in other words, federal government bonds, mortgage-backed securities, they bought to support the economy. Now that's made the interest rates a little precarious. So I think we need to say fully that somebody's going to have to pay the bill ultimately. In other words, the bill is a federal deficit that's increased now to 3 to 4 and probably up to $5 trillion this year. Now, ultimately, it's going to be paid for by higher inflation, higher interest rates, or higher taxes, or a combination of all three of those. So that's the warning, I think. Now, I don't think we'll see any one of those three until the middle of next year, 2021.
And my grandkids will be paying for that stuff.
That's right.
Yes, that's right. We baby boomers, and I'm one of them, will get off potentially scot-free. Depends on when they levy those taxes and those interest rates higher than inflation. Yes.
We got some questions coming in. Let's get to those. First one here is, based on your observations of Iowa's economy at this time, what sectors are being hit the hardest?
Oh, yeah, that one is certainly leisure and hospitality. In other words, this is a very unusual recession. It was led by the consumer, and it happened in leisure and hospitality. That would be restaurants. Restaurants are still not back. The fact that they've been open, they still have to abide by the social distancing, and also they have to get employees. The employees are hard to come by right now because of some of them are making more now by being unemployed than they were working, and that ends again at the end of July. But that's the first industry. The second industry, we do two surveys at Creighton each month. One of manufacturers. Manufacturers have not been as hard hit except in industries that are very important in manufacturing to Iowa. That would be ethanol. That would also be food processing. Been hit. Those have been hit harder than other manufacturers. And finally, well, I shouldn't say finally, but certainly a big factor is agriculture. And certainly agriculture is important to Nebraska and Iowa. And we're seeing that with lower commodity prices with livestock, or we're talking about grain. And that's a lot to do with international conditions, a global economic slowdown and supply issues, but also demand. The farmer is seeing lower and lower prices for the farm products to the purchaser, but then the consumer is seeing higher prices. There's a disconnect in there, and of course has to do at the food processing level.
You know, I'd also add that at the national level, from the most recent personal income report, the largest decline in consumer service spending in terms of dollar value occurred in the medical professions.
Oh yeah, certainly, yeah. That's a big issue. And certainly rural hospitals, rural clinics, big hit there. And we need to be very conscious of that, certainly in Iowa, for the rural communities. In other words, we talk a lot about it started in the urban areas, it hit the urban areas, at least the COVID-19. But the impacts now are really hitting the rural areas. We do a survey of rural bankers in 10 states, including Iowa. The numbers there are just awful. And that's in the rural areas. Retail sales in the rural areas down to the nub, except for, of course, Walmart and the big box retailers, where we're seeing some pretty good numbers there.
Another question here: how can policymakers lawmakers prepare for revenue shortfalls, and what policies should they be avoiding?
Well, certainly you're going to have to pull from any reserve funds. That's going to happen. And those reserve funds are going to have to be built back up. Also, we're going to see an increase in the unemployment rate charged employers next year. That's just going to happen to build up the reserve fund and the unemployment insurance funds. Despite the fact that the federal government's coming in with $600 per week per individual, that still you're draining the state sources there. We'll have to see that. Now, what we're going to have to see in Iowa is we're going to have to see some cuts. I mean, we in education, we've been fat in a lot of years, whether it's post-secondary, whether it's K through 12 spending. You're going to have, and we've got to share in the burden. The idea that somehow, and I have to say, we've been very successful in academics of arguing, don't hurt the little kids or the big kids. I'm sorry, but we're going to have to share in the burden. But beautifully, things like the Zoom we're seeing here now, we're going to have to move to that in K through 12. We're going to have to move to it in post-secondary. So there are some solutions out there. Government, we're going to have to trim the size of government, and we're going to be able to provide some of the services via provide it digitally. That's going to have to move faster and forward. We're going to see it, and that's going to happen. But bottom line is, luckily, I'm an economist, not a policymaker. I don't have to make the cuts. We have to have some spending cuts, and there may be some tax increases as well. I would call for user fees, not some, and lean on those more than taxes. Scott, any?
Well, I would go back to, let's make sure that we don't overburden businesses with new regulations, maybe even ease some of the supply side cost of doing business, especially if you're trying to help those smaller businesses reopen.
Yeah, well, I don't mean to jump in again, but some of this, what we've seen coming out of whether it's CDC, the federal government, I don't care, is nonsense. Nonsense on we find out wear a mask, don't wear a mask. So the idea that they can figure out what we should do in terms of a restaurant. Do we need social distancing? Do we need plexiglass? All this is sort of, we don't know. I mean, we don't know about a lot of this. So the fact is that we do need to open up the economy. We have to move in that direction. And if somebody can show me and show others, policymakers, not so much me, why we need to keep restaurants closed, why we need to keep bars closed, why we need to keep amusement parks closed, I'd like to see it. I mean, we've seen now, haven't heard the word social distancing discussed about those individuals that are taking place in terms of the protest marches. I don't think they're social distancing. I mean, in other words, we can pick and choose, but we've got to do some more sane regulation in terms of COVID-19.
This last week, Iowa has what they call a revenue estimating conference, which is they estimate what their revenue is going to be in the coming fiscal year, which I believe you were both quoted at that discussion, which is good. They estimated that the fiscal year 2021, I think, is going to be $390 million, and this is state revenue, less than what they expected pre-COVID. Not to put you on the spot, but do you think that is a fair number or conservative or not?
Well, one thing we're estimating, ours don't line up with these projections nor the tax collections. In other words, some of the impacts are coming because the April the 15th deadline was pushed out till July on federal and state tax collection, or filling out your forms. So some of those numbers, some of our numbers will not show up until next year when we come around to April the 15th, when you fill out your taxes for the previous year, and you find out you don't owe as much as you thought you did. That's some of it. Scott, you can probably chime in here better than I on. So our numbers won't necessarily jive with the projections, particularly in terms of state, in terms of personal income and corporate income tax collections.
Yeah, ours are going to be mostly on those income tax variables. Without seeing the numbers that Walt mentioned, my suspicion is that those are payments for economic activity that has occurred in the past, say last year. We're dealing with economic activity that occurred fairly contemporaneously here in 2020. Most of that, especially for the individual, is going to be picked up in the coming year.
Right.
Talking about the restaurant industry and the leisure industry, with these businesses only operating at 50% or less and following other social distancing rules, how do you think that is going to impact the recovery?
Well, Walt, you got also the casinos, where you got state and local tax collections, and these are tax collections, these are tax rates that are much higher than the state sales tax rate. In other words, if you're talking about casinos, you could be as high as 22%. So some of this we're going to see going forward, and it's going to be quite significant. So what's going to happen is the pressures are going to be, I would argue, are going to be more at the local level. And we keep talking about the state level, but the local levels where you have property tax rates, assessments that should be coming down. In other words, for example, farmland prices, the assessed amount should be coming down. I'll bet they won't be as responsive as we're assuming they will be. Those assessments should be more responsive. They were very responsive on the way up when the farmers were making money head over heels. They didn't feel that way, but they were making better money. The rates were going up, the assessments were going up, and the tax collections are going up. We're going to have state and local governments are going to have to pull back, and in some cases you're going to have to see in more state aid to education through, and that's going to affect the state budgets as well. Scott?
Well, I think when again I go back to that personal income report, we had casino gambling down 90%, air transportation down 90%, movie admissions down 100%, and other live entertainment and sporting events down 100% on a month-to-month basis. When I look at those numbers, it's going to be what we're going to have in terms of recovery in those markets is going to be a function of how quickly people are going to be willing to go back to a live entertainment venue or a bowling alley.
That's some of that as well.
And I don't think that's a policy issue.
Right.
Yeah, and I think that the live entertainment venues and the big market venues, pro baseball, and that doesn't affect Iowa much, but the Iowa State Fair and all those types of things are all going to affect how we respond to this.
Certainly. Right.
What are some economic lessons that you have seen and that we can, as a state and a country, learn from this crisis?
I think one lesson is that we need reserves to plan for what sometimes are called black swans. These are events that are low probability but high cost, and this would certainly fit into a black swan event. Now, we should have probably seen it, but we couldn't have seen it any earlier probably than December of last year. So this is an event that's very high cost. So what I would argue as more of a conservative economist, market-based economist, is more pressure on don't spend in the good times, so you don't have to cut back. Don't spend as much in the good times, so you don't have to cut back during the bad times. So increase reserves. That needs to be done. Draw down on reserves very slowly or very cautiously, because you could have events like this. This event, I mean, we had lots of folks out there saying this was going to be a minor event. Listen to a lot of radio announcers. Oh, it's going to be like SARS. And remember SARS? Well, most people don't remember SARS. Most people don't remember Ebola. Why? Because it wasn't as significant as this is. And we have to watch out. I think watch out for the recurrence of the COVID-19 in the fall, and hasn't gone away in the summer either, but nonetheless. And I think we have to move, and this is not an economic issue, but it's certainly public policy. Public policy makers are going to have to face up to the fact, and I think they have, I can't, that we've got to keep the economy open. Moving back to closing down the economy the way it was closed down cannot be sustained. So if it does, we do see infection rates grow and death rates grow. We're going to have to pull back potentially, but we're going to have to move to another model. It may be quarantining people who are over 60. It may be quarantining those women and men who have comorbidities. There has to be other solutions, and New York and California have not provided that solution.
Well, we're going to do one more question, and then what you just said really is pertaining to this question, and you can just expound on what you were talking about, and that is, what happens if we do have COVID-19 come back as far as cases? What will we do as an economy? And you've kind of answered it, but what do you recommend what we do as an economy?
Well, I'll take a first stab at that, and then Scott, okay. But one thing we've learned is we can deliver some services effectively via Zoom, via other digital assets, and that's a good thing. Government services, we in academics are going to have to move toward a hybrid approach in the fall. Whether if COVID-19 is gone, we still have to move toward this more of a hybrid approach. K through 12, particularly in rural areas, we're going to have a hybrid approach. We need to focus on also broadband access. Can you get broadband fast access in Mount Airy, Iowa? We'll see. And that we have to move in that direction and putting more of the infrastructure, the money that the federal government is providing, into the infrastructure that would be the backbone of the internet and these services that we're delivering now. Because spending, individuals are, my spending, I think most people tuning into this, their spending has gone down. I put some cash in my wallet a month ago, some of it's still there. So I'm spending less, and that hurts the overall economy. Scott, you want to chime in?
Well, the only thing I'd add to that is don't send people that have been exposed to COVID-19 to nursing homes.
Yeah, that's one certainly, and if we do, we've got to have some provisions for those. But in the interim, the idea that I think we need to dispel the idea that everybody who gets this disease, or whatever you wish to call it, the COVID-19, it dies from it or is seriously ill. There are some people, individuals that aren't as negatively affected. Now, we need more information from a statistical point. CDC is not providing us enough information, not nearly enough. In other words, I've been told I've come from fairly significant Scandinavian background. You can relax. You're not going to be hit as hard as someone who comes from Hispanic background. Is that correct? I don't know. I can't. We need to know these numbers. We need to know more statistics, and we're not getting it. We're not getting it from CDC. We're not getting it from any organization I've seen tell me what are activities that you are. Well, we know getting up close and personal is one factor, but what else? What are some other issues? We just don't know.
So I think it's safe to say that if there is, God help us, if there is a second wave of the virus, you two would strongly recommend not going down the road of a shutdown or lockdown of economies.
Absolutely not. Absolutely not. There would have to be some adjustments, but we've already made one thing about it. We've gotten smarter. Well, we have gotten smarter, and this is not the way I want to get smarter, but we don't get other choices, and we will adjust. But the idea that there were two economists, I was going to say out of Hollywood, they might as well have been out of Hollywood, said we need to close this economy down until 2022. Now, what nonsense is that? Only on an academic living in wherever could come up with that. So it's not possible. We cannot close this economy down. We're getting too many deaths. And as Scott said, the healthcare industry has been, I won't say decimated, it's been hurt, significantly hurt, because we're not getting colonoscopies, we're not getting mammograms, all these preventative healthcare measures that we're not taking advantage of, which is going to increase the morbidity later on. We've got to wake up here. This is...
Plus the fact that our agriculture economy feeds the world.
Absolutely. I think that's important, Walt. We need to discuss that. The agricultural economy, what do we do there? you know.
Right. So, okay, well, we again appreciate you guys giving us your time and your effort on this report and helping us here in Iowa try to figure that out. We have our full report on our website, TEF Iowa, and again, we'll have another report about the addition of this COVID-19 in the coming months. So
As we get more data.
as we get more data, yes, got to work with data.
Everybody, data is data, you know, got to have data.
Dr. Goss, Mr. Strain, thanks so much for being here.
Thanks, Walt.
Thank you,
to all
Walt.
of thanks for your organization.
Take care.